so Peyronie's disease. I think it perplexes a lot of people in practice, or it's not the favorite thing for people to specialize in. I manage a lot of these patients, and we heard a little bit from Jesse about his technique for some office things. I'm going to try to give you some more tips to kind of tackle these patients when they come into the office. So in terms of objectives, I want to help you develop an approach to managing the man, right? One of the things my son likes to say, he's a soccer player, is, you play the ball, play the man, you got to decide, what's appropriate in any given, opportunity. And so there's a lot of dogma in sexual health, right? And we talk about data versus dogma. And there's a lot of that in Peyronie's disease in terms of when we intervene and what we do. And I want to highlight an efficient management algorithm that also allows technology is problematic. So when they come in and you tell them that, I think you have Peyronie's disease, they're like, oh my God, I have a disease. Well, it is certainly a state of dis-ease, but it's not something running through their whole body. The fibrosis is similar to injury responses elsewhere. So if you think about a green stick fracture, right? You're bending something out. It's almost like cracking a glow stick. But that also lends itself to questioning some of our traditional dogma for what's going on if it was truly a tunical injury. So there's a lot of garbage in print as it relates to what causes it and the timeline, okay? So if you think about it too, most of the plaques you guys are going to see are going to be on the top side of the penis. And if you think about it being from flexion trauma, if somebody doesn't recall something specific, usually what happens when the penis is bent during sexual activity, it's bending up towards the body. Think about your common penile fractures. In that case, though, the top side where the plaque eventually occurs is the site of relief. The most tension